Hello, my name is Jana Majzlíková, and I help firefighters to tackle their workplace challenges. How many of you have ever complained about your job? Sometimes we have to work when we are tired. Our bosses don't always explain properly what they want from us. Do you mean that firefighters might go through the same struggles? They do. After my studies of supervision in social organizations, I did some research and later adapted the concept of supervision to firefighters. Today, I'm going to show you how psychologists support firefighters in the fire rescue service by empowering leaders to implement supervision within their firefighters brigades. I'd like to put you in the picture what we have now in the fire rescue service, which is a crisis intervention program. Then what's new, supervision, and last but not least, how can psychologists cooperate with others? Supervision is essential for firefighters' well-being. It's crucial to letting off steam, keeping on the top of things, and talking through challenges, as this is later reflected in how firefighters help protect the public in emergency situations. It will take about 15 minutes to cover these points, and then will be time for your question in chat box. So let's get started. It is a crisis intervention system that we use in the fire rescue service to manage critical incidents. Let me start by giving you some background information. There were several reasons for introducing a psychological service to firefighters. One of them was the research done in Czech Republic. What researchers found out was that firefighters experience more psychosomatic symptoms than others in the same age, even though they pay attention to their physical health and general health. Some emergencies that firefighters face tend to end up in traumas. And as I said at the beginning, we need a specific crisis approach for them. Let me explain it in more detail. In around 2002, a psychological service really came into existence and brought a multiple component approach called uh, critical incident stress management, focus on mental stress and traumas. Let me put that in a nutshell. System interventions consist of number one, the pre-crisis phase, for example, prevention and education. Number two, the acute crisis phase, which means go to the field, talk them on the spot where incident happened. And number three, the post-crisis phase. We use intervention like diffusing and debriefing. In other we talk in a small group or a large group about everything that they experience in the field. Based on our findings, critical incident stress debriefing, CISD, with its 7 phases, is quite an inflexible, conservative, and strict intervention. For instance, you can imagine such emergency situation like a massive car incident. Some of firefighters mm, want to discuss how terrible they feel. Some of them want to talk about their boss orders in organizational management, and some of them want to know how to communicate with people who survive it. To put it simply, each intervention and each firefighter's unit needs something different each time. They basically want to have flexible interventions. Flexible intervention as their job are hectic and full of unexpected situations. And flexible interventions go hand in hand to an individual adaptation. Why do I say that? The crisis intervention program works, and it's good that we have in place for reasons I've mentioned. But now we need something more. Moving on to my second point, which is supervision. As you are aware, supervision has already become a regular part of many professional teams in many organizations, especially in drug, alcohol, and social service. However, this relates to what I was saying before. Supervision is not a common part of firefighters' brigades. Saying that, I've good news for you. Supervision is being implemented in our region, Ústí nad Labem, slowly but surely. It's implemented because it offers more flexible and more flexibility and individual adaptation than critical incident stress management. What do I mean when I use the term supervision? It's an organized space where for reflection in the work context where supervisees and the organization work very closely together, and in the Czech Republic there's often team supervision providing by an external expert. Its goal is to support workers to improve their work and also to enable professional growth in their organization or profession. And do you remember what I said about the massive car accident? What I mean to say is that we can supervision session apply for all those firefighters' needs. We can talk about everything what they do behind the closed door in the offices of the firefighter station before something bad happened, during emergencies, and after some catastrophe too. Let me expand on this point. What supervision should do is promote good practice for firefighters. They can really share their experience. It's a brilliant opportunity to share their experience, improve their work, and based on our findings, our research, we propose another variant, which is to empower leaders within the firefighters unit to perform managerial supervision. Supervision is a new tool for firefighters. The first step is to empower their leaders to implement supervision within their firefighter centers, which we have already started. Now let's move on to my last point. What's the vision for the future when it comes to supervision? Let's look how important it's for firefighter psychologists to work closely with other humanitarian organizations in order to supervision to be even more effective and successful. The good thing is that there is already a good long-term and known cooperation between humanitarian organizations when it comes to emergencies. There was a massive flood 2002, and this was the first time when helping professionals of many humanitarian organizations, including the crisis staff of municipalities, counties, and integrated rescue system, came together to form a panel to tackle this crisis. The cooperation between these professionals wasn't as good as it's now. It's been developing over the years to get to the present stage. And what's very important to get information, experiences, and contacts so we get to know each other in the region. Why it's important? Let me give you an example. There was a fire in the house adapted for people with disabilities last year in a small village in the north of Bohemia. Unfortunately, 9 clients of this house died. It was rescuers, staff of this house, and helping professionals of humanitarian organizations that were hugely touched by the situation. And what happened was the supervision sessions were inspired by principles and techniques of supervision work. But right now, we are organizing only ad hoc supervision sessions after the catastrophe. This relates to what I was saying before earlier. We need to have a flexible, appropriate, and regular interventions for firefighters and helping professionals, and not only in case of catastrophe, disasters, and crises. The ideal outcome would be to have supervision as a part and parcel of our panel of humanitarian organization as long-term, continuous, and aimed approach. It is firefighter psychologists uh, that could encourage and mediate it. So that covers everything what I want to say about how psychologists can bring a new vision when it comes to supervision for cooperating with others humanitarian organizations. And this brings me to the end of my presentation. So let's just recap. Supervision is a must for helping professionals. Supervision is a must for firefighters. Supervision is a must for us. The most significant thing I want you to remember is that everything that we do in our offices behind closed doors in our offices is as important as our work in the field. We believe that supervision will improve the lives of many firefighters in their workplaces. Are you ready to get supervision too? Thank you for your attention.